Just a couple of reminders here before we get started. Is one, try to work on your verification quiz, the Respondus quiz. If you haven't done so yet, try to get Respondus downloaded onto your to your device, your laptop or your computer or whatever, or install it through Chromebook, and try to take care of that as soon as possible. I have the date set. I mean, it's a flexible date. But we want to try to be able to work any bugs out if people have problems or issues with getting Respondus set up on their computer before we get to the first test. Obviously, the first test is still a little ways away because we've got to get through chapter 4. But we'll be finishing chapter 1 up on Monday, and that'll be getting us closer to it. Also, make sure you work on your chapter 1 assignment if you haven't done so. It'll be due Monday evening. So as we wrap up chapter 1, you'll want to get that out of the way so we can get into chapter 4 and get through that material. Again, when we finish chapter 4, we'll have a review class before the exam. I always like to try to do a review day before we have exams. So the class period that we'll meet before the exam day, we'll do a review Zoom. The reviews work like this. If I haven't mentioned it before, it's a discussion. All right, it's an open forum. You're going to come to the review that day with questions for me or with topics that you want me to talk about again because you've been going along and studying as we go. It's not going to be me just kind of showing up and going, hey, all right, let me re-lecture over chapters 1 and 4. Instead, it's driven by the students. So as you're going through and you're studying and you're preparing, make little notes and say, hey, I know he talked about this in class, but I'd really like to hear him talk about that again. And then come review day, just pipe in and say, hey, Dr. B, can you, talk about, negative feedback cycles like we're going to talk about today? Hey, Dr. B, can you go over x-rays again, like we'll do in a little bit? Can you talk about this tissue and explain of this? So have questions like that when we do the review, and we'll review as long as y'all can, hit me up with topics and questions on review day. So I'll touch on that again as we get closer, but I just wanted to kind of put that bug in your ear so that you, kind of prepare as you go with this. Any questions, just kind of general questions before we get rolling on chapter 1?
If you already have a responders program for different class, do you still have to do the test?
Still do the test for me, yeah, just so that I'm aware of, hey, this person's capable, this person's capable, this person's capable, and anybody that doesn't do it, then I'll reach out and say, hey, did you just forget? Are you having issues with it? And things like that. But if you already have it downloaded for another class, you obviously don't have to reinstall it. You can use it for that class, but just take the verification quiz so that I know, who's prepared and who's maybe having some issues and stuff. So all it is like a one question thing, and so it's just a way of letting me know that you're set up and you're ready to go. Anything else? All right, then let's pick up where we left off in chapter 1, which was with feedback systems. Let's see here. All right, so last time we wrapped up talking about homeostasis, and the next thing we're going to jump into is the responsiveness that we talked about when we talked about the 6 life processes last time. Responsiveness is based on monitoring our internal and external environment and making changes associated with the information that we gather from those things. This is done by different types of feedback systems that are established in our body to monitor, interpret, and change things in and around us. Now, every feedback system is going to have 3 primary components. Every feedback system is going to consist of a receptor. Every feedback system is going to consist of a control center, and every feedback system is going to consist of an effector. And the way that this works is that we'll have some type of stimulus which is going to initiate or activate some type of receptor. That receptor is going to send the information to the control center where it's going to be interpreted. And then we're going to, decide if it's something that we need to make a change or if we can, just maintain the status quo. And that's basically feedback, and I think we mentioned this, we kind of, exist based on feedback, everything in our life. Do I need to, the mail truck came, I see the mail truck, and then get out of my, go out the front door and go get the mail. I mean, that's a feedback system. So, the majority of things in our life are based on this type of cycle. We just never really sit down and think about why and how we do things based on this. So receptors are going to be found all over the body, both inside and outside of the body. And receptors are constantly monitoring the environment. All right. We're constantly looking for a particular type of input for a particular type of receptor. For example, a thermoreceptor is just going to monitor temperature changes, and a chemoreceptor is going to monitor possibly pH or blood glucose levels. A baroreceptor might measure blood pressure. We're going to have touch receptors in the skin, and we'll have pain receptors there. We'll have receptors that detect things like itching and tickle, and all of these sensations and all of the information that we could possibly take in are going to be done so by these receptors. These receptors don't choose what they record. They're going to record anything that they're designed to record. So if we have a thermoreceptor, it's going to measure the temperature, no matter if the temperature is high or low. It's just going to measure it, and it's going to send it to the control center. The receptor's job is not to interpret, it's just to gather, right? So when we think about feedback systems, I use an example of like a security system. When you have cameras for a security system, what do they record, right? Do they just record the bad things, or do they just record the good things, or are they on when there's nothing there? Yeah, they just record everything. It's not the camera's job to decide what to record, it's just the camera's job to record it. So that's what we see with these receptors. They're just gathering the information, no matter what it is, and they're sending it to the control center. Now, for us, the control center is our brain and our spinal cord, primarily the brain. The spinal cord has some capability of thinking, but not in the way that the brain does. So the brain is going to receive all the input from these receptors, and it's going to analyze it. If it analyzes it and determines that there needs to be a change made, then it will send a signal out that will make that change. If it analyzes it and decides that it's within our normal physiological limits, then it won't make a change. Okay, it's the deciding factor. All of those cameras are gathering information and sending it to a control center somewhere where there are people watching them. Okay, people deciding what's going on these cameras, or on these screens, if it's something that they need to address or respond to. So as we gather this information and we interpret it, we then, if we have to make a change, we'll do so using a couple of different ways. All right, we'll either send signals out through the nervous system, or we'll send signals out through the endocrine system. The nervous system is going to work through nerve impulses, and the endocrine system is going to work via hormone circulation. Now, as we send these impulses out, or these hormones out, we're sending them out through or to what we call effectors. Just think of the word effect. Okay, we're doing something. We're having an effect. We're making a change, and the effectors are generally going to be found in the forms of muscles and glands. Muscles can alter the way something is being used, whether we're talking about skeletal muscle or cardiac muscle or smooth muscle. And glands are going to secrete things like hormones or sweat or sebaceous oil or earwax or whatever, and they're going to make a change to the environment based on whatever the body is trying to alter or change. So every tissue can be affected by something. We give an example here of body temperature. If body temperature drops, we're going to have thermoreceptors in the skin, which are going to gather that information, and they're going to send a signal to the brain. The brain is going to sense that our body is colder than it should be, and it's going to make an effort to warm us up. And the easiest way for it to do that is to create a skeletal muscle response, which we notice as shivering. When skeletal muscles contract, they're going to use ATP. That use of that ATP gives off heat energy. So we're responding to that temperature drop around us and in us by creating muscle contraction to help bring our body temperature back up. And so that's a basic example of feedback. Now, when we talk about feedback systems, we have two different types of feedback systems. We have negative feedback systems and positive feedback systems. Now, negative in this sense of the word doesn't mean bad, all right? In fact, in anatomy, we don't usually consider negative as being a bad thing. Negative often just describes direction to us. If something is going in one direction, it goes the other direction, it's negative. When we talk about negativity within cells, we're talking about polarity. So positive side, negative side, which means, more on one side, less on the other. And when we talk about negative as far as tests go, negative is generally a good thing. If the test is negative, it means you don't have it. So the word negative doesn't usually mean bad when we're talking about it in human anatomy. And in this case, with negative feedback systems, it just means that we're reversing the direction that the change is heading. So if body temperature is going up, we want to make it go down. If body temperature is going down, we want to make it go up. If blood pressure goes up, we want to make it go down. So we're making it a change that is forcing it to go in the opposite direction. Positive feedback cycles are designed to reinforce whatever change is occurring. So if something is going up, we want to continue to make it go up. If something is happening strong, we want to make it happen stronger. If something is decreasing, we want to continue to decrease it, meaning we're heading in the same direction. And that's what we describe as a positive feedback system. Now, we give a couple of examples here, and we're going to walk through these examples and tell you the receptors and the effectors and those types of things. And for a negative feedback system, blood pressure is a perfect example. When we get a change in blood pressure, all right, we have some type of stimulus that causes blood pressure to increase. That stimulus could be chemically driven inside of us, or it could be externally driven. You're driving down the road and somebody cuts across in front of you in traffic, and it causes your blood pressure to spike. Whatever the stimulus may be, blood pressure goes up, and our body is going to detect that. We have receptors located in certain blood vessels that are going to detect changes in pressure, and they're going to send a signal to the brain saying, hey, brain, we've got an elevated blood pressure situation. Okay, we need to rectify this as soon as possible. So the brain is going to gather that information, and it is going to respond by doing two different things. The effectors it's going to utilize are going to be muscles. We're going to see the heart start to slow down, and we're going to see blood vessels start to vasodilate, which means they're going to get bigger. By the heart slowing down, by the vessels getting larger, it's going to cause a change in blood pressure, which is going to drop. So as pressure decreases, then the heart rate and the blood vessel size will go back to normal, and pressure is restored to what it was before whatever the stimulus was elevated it. All right. Now, the majority of our feedback systems are going to work in a negative capacity like this because, we're constantly fighting against external changes to homeostasis. So this is a homeostatically driven feedback system. And so we are trying to get us back to the norm, and that's going to require going and reversing in the opposite direction. Now, childbirth is an example of a positive feedback system. Now, positive feedback systems are not always considered to be a homeostatically driven occurrence because it's not always something that we're trying to get back to what we consider a basis or a normal condition. But, childbirth to me is actually, a little bit of a homeostatically driven process. If you think about pregnancy and not being pregnant, we would consider not being pregnant a normal state. I mean, we don't exist, or I shouldn't say we, okay, I've never been pregnant, not going to be. But, women don't exist in a state of being pregnant. That's a very short-lived time in their life. So, not being pregnant we would consider to be the norm. So when you are pregnant, getting back to that normal state requires taking the baby out of, the body, getting the baby out. When contractions start, we're going to force the baby's head or body into the cervix. Now, the cervix is going to have stretch receptors located in it. These stretch receptors are going to fire off and send a signal to the brain. And as the signal goes to the brain is going to interpret this, and it's going to make a change. Now, if this was a negative feedback cycle, the negative feedback cycle would dictate that we would stop the contractions because we would want to stop the stretching of the cervix. But this is a positive feedback cycle. So we don't want to stop the stretching of the cervix. We want to stretch the cervix more. And the only way to stretch the cervix more is to push the baby harder against the cervix. So as the brain gets this information, it's going to cause the release of oxytocin. Oxytocin is going to increase uterine contractions, and the head or the body of the baby is going to force itself into the cervix more. This is going to create more stretching associated with the cervix, which is going to send signals to the brain, which is going to cause the brain to then release more oxytocin. More oxytocin means harder and more frequent contractions. So instead of stopping it or going in the opposite direction, we're enhancing it with every signal that we send from those receptors. How long does this cycle continue? Well, it continues until there's no stretching. And when does no stretching occur? When the baby is out of the birth canal. So once the baby's out of the birth canal, the signal stops firing to the brain stops releasing oxytocin. We start to break down oxytocin in the body, and that's going to then allow for contractions to slowly start to subside. And then we've actually restored the normal, or what we consider normal, for the human body. All right. So that's an example of positive feedback systems in the body. Now, diagnosis of disease is done by a few different ways. Obviously, the first things we think of when we think about disease processes is we think of signs and symptoms. And signs and symptoms are actually two very, very different things, although they kind of get lumped together and talked about like they're identical. Signs are objective findings. Okay, a sign is something that we can measure. A sign is something that we can quantify. All right. So things that would be considered signs would be things like changes in body temperature, measuring your body temperature, measuring your blood pressure, checking your blood glucose levels. All right, those would all be signs. It's something that we can give a value to, and we can see if that value falls within a normal range. A symptom is something subjective. Okay, so a symptom is something that we ask the patient about, and we get feedback from the patient. Now, this makes a symptom kind of an opinion, right? It's subjugated to the individual's response. So if you ask a person, Mrs. Jones, today on a scale of 1 to 10, what is your pain today? Mrs. Jones is going to answer you however she feels, but it's nothing that we can actually measure. So, things like pain and nausea, anxiety, these are all going to be symptoms that are important in the diagnosis of disease, because it gives us, a direction with which to go and further investigate. But it's not something that we can actively measure as and or actually prove that the patient is experiencing. So, signs are going to become a little more important than symptoms, but oftentimes symptoms are going to help us to differentiate between what could possibly be causing the signs. Because lots of things can cause the same signs. I mean, fever, elevated body temperature, that's a sign that we can measure, but what causes elevated body temperature? Well, there's lots of things that cause elevated body temperature. So we then may want to look at the symptoms along with the signs that we've recorded to be able to begin the process of diagnosing the disease. Notice I said begin, because we cannot just diagnose the disease by signs and symptoms. What's one of the reasons why we can't just use signs and symptoms, other than the fact that there's a lot of crossover between diseases as to how they present themselves with signs and symptoms? What if signs and symptoms aren't there? Okay. What if the patient has no signs or symptoms? If they don't have any signs or symptoms, then how can we just diagnose disease based on lack of signs or symptoms? Why would we even begin the process of it if we don't have any signs or symptoms? If you have a bacterial infection, chances are that bacterial infection has been there a while. You may have had, the bacterial infection for a week or more, before you started to express those signs or symptoms. So we can't just go by them because one, sometimes they're not there, and two, they could lead us to 6 or 7 different things that those signs and symptoms present as. So how are we going to further proceed down this diagnosis process? Well, we need to take a medical history. And a medical history is going to revolve around finding more about the patient. Okay, taking inventory of where the patient has been. You know, when you go to the doctor, one of the very first things that they ask you when you go to the doctor is, have you been out of the country for the last 6 months? Well, they don't ask you that now because nobody's traveling, but before they would ask you if you've been out of the country. Well, why was that important? Well, because there are some diseases in certain parts of the world that are unique to that part of the world or more prevalent in that part of the world. So that could be, you know, something important to get from the patient. Past illnesses, past medical problems, family history. These are important things that we want to gather from the patient because they could give us more clues to the proper diagnosis of the patient. And one of the things to be careful about, you know, with patients is they don't like to be honest all the time. All right. And I don't mean purposely, you know, they just sometimes forget, or maybe they're in a hurry or whatever, you know. So if you have, especially if you have a new patient that's coming in and they're filling out their original intake form, um, people don't read all the questions on that intake form. All right. People are in a hurry because, you know, if you walk up to the counter as a new patient and somebody else walks up there as the new patient and they both hand you the paperwork at the same time, it's a race. Okay. Who can fill it out the fastest? Because that's going to get me back there the fastest. And then I'm going to get out of here the quickest. Okay. So they don't read that oftentimes. And everybody in here is probably guilty of it. I know I am, you know, of when you're filling out that information and you see all of those things in family history. You know, a lot of times you just check, no, 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 no. You're just I used to have patients when I practiced that would just draw a line straight down all the no's. They wouldn't even check them individually. So, you know, sometimes it's good to, you know, go over that type of stuff, ask the patient why they're here. And if they are complaining of, you know, some shortness of breath and this and that, go to their intake form and see if they checked off anything in family history. And if they checked no, ask them about it again. Okay, it only takes a second to ask them and double check that. And they may say, oh, you know what? I didn't even see that one there. Yes, I have a hit. My father had problems with breathing as well. He had emphysema. So, you know, take the time and to double check patients because they're not always going to be, you know, completely honest and forthcoming about, you know, their present problems and past problems as well. And then the last part is the physical examination. Physical examination is probably one of the most underutilized parts of the of diagnosis of disease because people are becoming less comfortable with putting their hands on patients. You have to touch patients. You have to touch people. If you want to take care of people, that's a necessary part of it. And, you know, a lot of times patients become more reassured when you do make contact with them. The human touch is a very, very powerful thing. And if you put your hand on somebody's shoulder when you're talking to them or, you know, as you start to, you know, examine them or something like that, a lot of times it will relax the patient. It'll let them know, hey, this person cares about me. We've all been to the doctor before where, you know, the nurse comes in, they take your vitals, the doctor comes in and the doctor never touches you, sits down in a chair across the room, talks to you for a minute, writes out a script for you and sends you on your way. That doesn't evoke a lot of compassion to me that they're very vested in, you know, in the problems that I have. And then certain doctors have to touch you. I took my son to an orthopedic, you know, when he hurt his knee in high school, and the doctor came in, and you know they had taken some X-rays on him, and he came in and looked at the X-rays as well. You know, it's not broken, and you know, and it's probably just sprained. Never touched my son's knee, never did any type of orthopedic exam on the knee to test for stability or ligament laxity or anything. I did those things. I did those things before I even took him. And this orthopedic surgeon didn't touch his knee. I said, okay, well, you know, I appreciate it. Well, just come back to me, you know, if he's still having problems in a few weeks. I was like, okay, sure. Yeah, we definitely will. I'll schedule an appointment. I didn't schedule an appointment with that doctor. I didn't go back to him. If you're not going to put your hands on my son and check him out, then you're not doing your job. you'll be surprised at what you can find too when you do a physical exam. And here's a great example as to why it's important. When I was practicing, one of the girls that was working for me, she worked my front desk, was my office manager. She was pregnant, and she was about 7 months along, and she started feeling bad. She took a day or two off of work, and she called and said, I'm really still not feeling good. I'm not sure if I have the flu or if I have some type of infection. I'm going to go to my OBGYN because I'm not sure what I can take. I said, great idea, go see them and see what they can tell you. So she goes to her OBGYN, and they do some blood work on her. They test her for the flu, all these things, and it all comes back negative. And so the doctor's like, while you're here, let me just check out a few things. Let's see if you have some inflamed lymph nodes and things like that. Maybe you're dealing with some type of infection. So he starts palpating her neck, just to feel for the cervical lymph nodes, and he feels something abnormal, okay, that he didn't expect to find. And come to find out, she had thyroid cancer. That's why she was feeling run down. That's why she was feeling lethargic. She didn't have the flu. Well, if he hadn't decided to palpate her neck, if he hadn't decided to check her out thoroughly, when would it have been caught? How long would it have gone? And it was far enough along that they chose to do surgery on her while she was pregnant to remove that half of her thyroid gland. So the fact that the doctor put his hands on her, he was able to find the abnormality with her thyroid gland and catch this thyroid cancer before it became even worse. So again, it's important to use all of these tools when you're properly diagnosing disease with patients, because you never know which one of them is going to be the best clue in helping you develop the proper diagnosis. All right. So keep that in mind as you're working with patients and things like that. And again, be thorough. All right. Don't be afraid to ask patients questions. When you're asking patients what medication they're on, okay, and they dump their purse out, take inventory of it. Ask them if they're on any supplements as well. Okay, over-the-counter stuff gets overlooked a lot of times because patients think, oh, if I take something over the counter, then I can do whatever I want with it. Well, they don't understand how this might interact with this or how this might create this. So just make sure you take a full inventory, because that's going to give you the best foundation for properly diagnosing. All right, so the next few minutes we're going to spend kind of running through the organ systems of the body. This is just going to be something we're going to kind of briefly do, because obviously we're going to spend time on these organ systems as we go through the semester. But I just want to kind of point out what each of the 11 organ systems are that make us a viable, functioning organism, and give you an idea as to what organs are present in those systems and what the primary functions are. Because I want you to see that there's a lot of crossover between these organ systems, and that they aren't just doing one particular job by themselves. The integumentary system. The integumentary system is made up of the skin and the related accessory structures. Now, some of the related accessory structures are organs, and some of them are not. How do we know that some of the accessory structures are organs? Because by definition, in order for it to be classified as a system, we have to have multiple organs present. The skin, that is one organ. That's our body's largest organ. So we have one established, but we also need to have other organs present. Now, what other organs can we have present? Those would be the glands. Glands can be classified as simple organs because we have two tissue types present. So your sweat glands, your sebaceous oil glands, these are all classified as small little organs. Now, hair and nail, those are really classified as accessory structures because they're only going to be made up of epithelial tissue. And when we get into the integument, we'll talk more about that, and it'll make a lot more sense. The primary job of the integument is to provide protection. I mean, your skin is your barrier to the outside world, okay? Not only as a physical barrier, but also as an interpretive barrier. We have millions of receptors located in the skin that are constantly monitoring the environment around us. So it's providing protection to us in multiple ways. It's helping us to regulate body temperature. It regulates body temperature by sweating. Okay, body temperature goes up, we're going to turn on the sweat glands, and we're going to help to regulate body temperature. But it's also going to regulate body temperature in conjunction with the cardiovascular system, which we'll see in just a minute. When we sweat, we're also going to eliminate small amounts of waste products, primarily nitrogenous waste, but we can also lose things like electrolytes, like salt. Okay, if we have excessive volume of salt in the body, our body can turn on our sweat glands to try to get rid of some of that salt, as well as turning on the increasing frequency of urination. The skeletal system, this is going to consist of all of our bones and joints, and the primary function of the skeletal system is to provide protection and support. Protection, obviously, that relates to protecting vital organs like the brain and the heart and the lungs, but it also is going to help us provide support, which is associated with the site of muscular attachment. The support, the strength of the bones is what allows us to stay upright and maintain balance in conjunction with that muscular system. Another function, though, that is kind of overlooked until we get in and talk about the skeletal system is that the skeletal system is going to house stem cells, which will become our red blood cells, white blood cells, and platelets. Our blood is going to be produced in our long bones and in our flat bones, which actually makes a little bit of sense because stem cells are important for the production of these cells, and we want to protect anything that's important. So in a way, by putting those stem cells inside of the bony tissue, we're providing them with protection so we can have enough production of these blood cells. The muscular system. The muscular system provides movement. No matter what type of muscle we're talking about, whether it's our named skeletal muscles, whether it's cardiac muscle, whether it's smooth muscle, any type of movement that we associate with the body, except for intracellular movement, we can attribute to some type of muscle. Obviously, visible movement we know is skeletal muscle driven. Movement of the blood through the body is going to be cardiac muscle driven. Movement of food through the digestive system, that can be smooth muscle driven. So movement is going to be the primary thing we associate with the muscular system. Notice, movement is not associated with the skeletal system. That's a common mistake that students make either in this class or in lab, is that they think, oh, well, the bones are moving, so the skeletal system is responsible for movement. The musculature, as it attaches to the skeletal system, moves the bones. The bones are just along for the ride. The muscles are providing the ride. Now, another function of the muscular system is it can help to generate heat for us. We mentioned a few minutes ago when we talked about body temperature that shivering would increase body temperature to a point. If that doesn't do enough, then what do we do when we're cold? Well, we get up, we move around, okay, we increase our movement, and that's what's going to help us increase our body temperature. And again, how is that done? It's done by the use of ATP and the production of ATP as well. You'll remember in the Krebs cycle, one of the byproducts of the Krebs cycle is creation of heat energy. So by making ATP and using it, we'll give off heat. The nervous system consists of the brain, the spinal cord, and all of the accessory nerves located in the peripheral nervous system, which would be sensory nerves and effector nerves. The primary function of the nervous system is to control and coordinate any function down to the cellular level. Anything that can be initiated and make change is going to happen from the nervous system. So maintenance of homeostasis becomes its primary job because it's gathering information and interpreting. It's acting as the feedback system. When we talk about the nervous system specifically, when we get to chapter 12, that's one of the points that I'll stress is that the nervous system is our feedback system. Now, in conjunction with the nervous system, we have the endocrine system, which is kind of like its assistant. The endocrine system's job is to also help to regulate and balance homeostasis. Now, it doesn't have a capacity of the receptor-driven part. It's going to not have a capacity to make decisions, but it is going to have a capacity to elicit a response, make a change, have an effect. The glands associated with the endocrine system, like the pituitary gland and the pineal gland and the adrenal glands and the thyroid gland and parathyroid glands. These glands are going to secrete hormones, which are going to make changes that we'll see utilized throughout the body, sometimes to directly to tissues, and other times these glands will release hormones that will affect and turn on other glands. But it's to help us make changes in regulation of homeostasis. Ultimately, though, the endocrine system is controlled by the nervous system. All right, so we think of the nervous system as the boss and the endocrine system as the foreman on the job, which is helping get things done. The cardiovascular system, heart, the blood vessels. The primary function of the cardiovascular system is transport, getting things from point A to point B. All right. We're going to dissolve things or move things in the bloodstream. So the heart is the motor, the blood vessels are the pathways, and the blood is the transport system. Another function, though, of the cardiovascular system is related to regulating body temperature. And we talked about this when we talked about the integument and said that there was going to be a relationship between the two. Now, we've seen the relationship between systems so far when we talked about the muscle and the skeletal system, and that's something that we obviously see a relationship there. But regulation of body temperature, I mean, how's the cardiovascular system gonna aid the skin in regulation of body temperature? Well, when we talked about the integument, I said the skin was the body's largest organ, which means the skin is going to be very, very vascular. It's going to have a huge blood supply. So we can use that blood supply to help us regulate our body temperature. How can we do that? By cooling the blood. All right. If we send more blood to the surface of the body, vasodilate the vessels in the skin, we send more blood to the surface of the body, we can cool that blood off. How can we cool that blood off? Because typically we're hotter than the air around us, right? Typically our mean or normal body temperature runs at about 98.6. So the air around us is usually cooler than 98.6. So as long as the air around us is cooler than we are, we can radiate heat to the air around us. Now, what that means is that when we get hot, we'll push more blood to the surface. Your skin becomes warm, your skin becomes flushed. And if we get cold, what are we going to do? Well, if we're cold, we don't want to have more skin near the surface. We instead want to blood near the surface. Instead, we want to hold that blood in close. So we'll vasoconstrict the blood vessels in the skin, pull the blood away from the skin, and it can help us conserve body temperature. And the third thing we can use the cardiovascular system for is water balance. The primary component of our cardiovascular system is going to be plasma, and plasma is mostly going to be water. So we can use the cardiovascular system to help us increase water retention or decrease water volume because we can alter the amount of water that we carry in the bloodstream. The lymphatic system is associated with immune response primarily. The lymphatic system is going to consist of our lymphatic organs, lymphatic vessels, lymphatic fluid, lymphocytes that are involved in immune response. But one of the other things that we associate with the lymphatic system is the transport of dietary fats and proteins. We normally associate absorption of nutrients with the digestive system. And we are going to absorb dietary fats and proteins within the digestive system, but we're going to use structures from the lymphatic system to absorb those dietary fats and proteins. They're going to be too large to pass across the membranes. And so we're going to transport them using the lymphatic system and then empty them into the cardiovascular system. Plus, like we said, immune response, filtering the blood. These are also going to be functions of the lymphatic system. The respiratory system. The respiratory system's primary job is gas exchange. Extracting oxygen from the air, putting carbon dioxide into the air. Notice what I didn't say the primary function of the respiratory system was. When people think about respiration, and I say, what's the job of the respiratory system? The first thing they want to say is breathing. And breathing is not a function of the respiratory system. In fact, breathing is not controlled by the respiratory system. Breathing is controlled by what system? or facilitated by what system? It's controlled by the nervous system, but what causes breathing? What system?
Muscular.
Muscular system, right? Because what's the air doing? It's moving in and out of our body, right? And I said anything associated with movement would be related to the muscular system. And the diaphragm, which controls or which initiates breathing, is a skeletal muscle. So again, don't put breathing or don't think about breathing as being a function of the respiratory system. All the lungs do is inflate and deflate. Okay, they're just along for the ride. When they inflate and deflate, they're allowing for gas exchange to take place. Now, with this gas exchange, we can help to regulate acid-base balance. The primary way we're going to regulate acid-base balance is using the urinary system, but we can use the respiratory system to help us in this acid-base balance because of the elimination of carbon dioxide. The digestive system, the esophagus, the stomach, the gallbladder, the liver, the small intestine, the large intestine, the pancreas, okay, your teeth, your tongue. These are all structures that are part of the digestive system. And the primary job of the digestive system is absorption of nutrients. We're going to break down food chemically and mechanically. We're going to extract the nutrients that we need, and anything that we do not need, we're going to eliminate in the form of solid waste. So that's the job of the digestive system. Of all the systems, the digestive system is kind of the most autonomous system that we have. We don't see a lot of changes occur within the digestive system because obviously the food that we take in and the process of digestion is pretty routine. And we'll kind of touch on this a little bit more when we get to the nervous system. But the digestive system is going to be a little bit separate from what we see with the rest of the human body as far as the nervous system is concerned. The urinary system. Urinary system's primary job is to filter the blood. All right. Elimination of liquid waste. Contained in those liquid wastes are going to be nitrogenous waste, which are harmful to us. Also are going to be electrolytes and ions that can affect our acid-base balance. But the urinary system, or the ureters, the urethra, the bladder, the kidneys, these are going to be the organs that are associated with the urinary system. Now, again, there's some crossover we see here. Acid-base balance. Again, we mentioned acid-base balance with respiration. When you get into A&P2, we'll talk about the urinary system. We'll talk about how it functions, and we'll talk about how the respiratory system helps us to compensate for our acid-base balance, and also for loss of electrolytes. If we exercise, if we go outside and it's hot and we're sweating profusely and we're losing high amounts of sodium in our sweat, it's going to cause a decreased concentration of sodium in our body that we need to have. And so we can then prevent loss of sodium in our urine. Conversely, if we have excess amounts of sodium, we can increase the loss of sodium in our urine. So we can use the urinary system for balance as well. And then the reproductive system. Obviously, the reproductive system is for the reproduction of a new organism or individual, but it's also associated with secondary sex characteristics, which help to differentiate the male and females within the species. So that's the purpose of the reproductive system. And again, you'll get through every one of these systems. We're going to talk about 4 systems in A&P1. You're going to talk about 7 systems in A&P2. Now, again, we describe the functions of all of these systems individually, but I think you can start to see that there's a lot of crossover between the functionality of these systems, and you should be able to see how if one system starts to decrease its function, how it's going to negatively affect other systems. And we start to see this kind of domino effect move through the body. This is why one system isn't necessarily more important than the other. because if one system fails, eventually all of the systems are going to fail. Again, outside of the reproductive system, which we just need to continue on as a species. But there's a lot of integration across these systems, and that's something that we're going to touch on as we go through the semester. All right, any questions up to this point today? All right. The next thing we're going to get into is a little bit related to kind of what you've been doing in lab. We're going to talk about how we refer to structures and in the human body and on the human body. When we talk about anatomy, we have a list of structures to identify different landmarks or different markings or different regions of the human body. And this vocabulary that we use about anatomical terminology is unique because we don't want to just use common name terms. All right. When we use common terms, there can be confusion depending on the parts of the country or the parts of the world that maybe people are from. So we came up with this set of vocabulary to identify these different regions. And as we go through today, we're going to talk about some certain regions. I'm not going to have you identify on the model every single region like you have to in lab. I'm going to give you a list that I want you to know. But we're going to talk about also how we reference these regions and structures to one another, because terminology like up and down and front and back, that's not going to be used as well. Okay, we're going to use a specific set of terminology to identify directions within the human body. Now, the first thing we have to understand is when we talk about directions and we talk about structures in the human body, we want to make sure that patients are in a reference point with which we can do that. So the reference point that we're going to utilize is something called anatomical position. And the diagram that you see in front of you there is a patient in anatomical position. Anatomical position is described as patient's feet flat on the floor, toes pointed forward, arms by your side, palms pointing forward, eyes level on the horizon. Okay, that is anatomical position. Now, for the most part, that looks like we would, the way we would stand 99% or 90% of the time, except for the position of the hands. Right? Nobody stands in anatomical position. I've never met anybody walking down the street or standing on the street that's standing in anatomical position with their palms facing forward. No, your palms are usually facing backwards or facing, towards you. So why this uncomfortable, unnatural position? Well, because it's about uniformity. It's about consistency. And everywhere in our body, we can have consistency except the forearms when we're not in anatomical position. The forearms contain two bones. Okay, the radius is going to run down the thumb side of the bone, and the ulna is going to run down the pinky side of the bone, or the pinky side of the forearm. Now, if we're in anatomical position, the radius is going to start on the outside and it's going to finish on the outside. But if we're not in anatomical position, meaning that the palms face backwards, now the radius is going to start on the outside, but it finishes on the inside. So we lack that consistency of the positioning of the bones. So that's the only reason why we have the palms facing forward like that. Now, when we start talking about terminology and we start identifying terminology as they relate to one another, we're going to use what we refer to as directional terms. All right. And directional terms typically come in pairs. Now, these pairs are what we refer to as relative terms, meaning that they have to be compared to something else. So when we're talking about structures on the body, okay, and I say, is your nose superior or inferior? You can't answer that question, all right? Because it's not just about the position of the nose, but it's about the position of the nose relative to another structure that you're talking about, all right? Superior means towards the head, higher than, towards the top, all right? Inferior means below, beneath, away from the head, lower than. So when you're talking about that, when you say lower than, right there, it's telling you you're comparing it to another structure. So if I say, what is my nose? Is it superior or inferior? The first question you have to say is to what? If you're comparing my nose to my mouth, then my nose would be superior because it's higher than my mouth. It's above my mouth. If I say, what is my nose to my forehead, you would say my nose is inferior. Why? Because it's below my forehead. So you can have one structure that is both. It just depends on what you're comparing it to. You know, in lab, you know, I use an example as comparing yourself to your relatives, right? That we use that term relative with these structures. Comparing yourself to your relatives changes what you're referred as or what you're referred to, right? I mean, I can be a father, I can be a son, I can be an uncle, I can be a nephew, I can be a brother, right? I can be a grandson. Yeah, I can be referred to as a lot of different things, but how you refer to me is based on who you're comparing me to. So the same thing applies to the structures of the body. We're going to compare multiple structures and we're going to talk about their relationship to one another. Ventral or anterior and posterior, or ventral and dorsal. Now, anterior and ventral mean the same thing.
Okay, I found this on the web for anterior posterior.
I was not talking to you. I did not say hello, Siri. Anterior and ventral are going to mean the same thing, right? Anterior means towards the front, okay? Posterior and dorsal are going to mean the same thing. Posterior is going to mean towards the back. Now, why can we use these interchangeably? Why is anterior the same as ventral? Well, the true meaning for ventral is belly, right? Now, for us, because we walk upright on two legs, our belly faces forward, so we can use the terms anterior and ventral interchangeably. We can't do that with four-legged creatures, okay? You can't use that with your dog or your cat because their belly faces down. Their belly faces inferiorly, and their back faces superiorly. So we can't use them in the same way with them. But for human anatomy, it's perfectly acceptable to say anterior or ventral. Both answers would be correct, okay? It's perfectly acceptable to say posterior or dorsal. Both answers would be correct. And how would we use this? Well, let's compare our sternum to our heart. Okay, the sternum is anterior to the heart. The heart is posterior to the sternum. But the heart is anterior to the spine, and the spine is posterior to the heart. Okay, towards the front, towards the back. Medial, lateral, intermediate. With these terms, we're using a reference point at the midline of the body. And the midline of the body is an imaginary line that's going to run through the episternal or suprasternal notch right here, and it's going to come straight down through the umbilicus, right? It's going to divide the body into a right half and a left half, okay? If we're talking about symmetry-wise, all right? I know that we're not perfectly symmetrical inside, but externally, we are a mirror image right and left. So we're going to use this midline as our reference point. So the closer something is to the midline, it's said to be medial. The further something is from the midline, it's said to be lateral. So right here, we have our clavicle, okay? It begins right there, and it runs to right here. So this would be the medial end of the clavicle, and this would be the lateral end of the clavicle, okay? Closer to the midline, further from the midline. Now, intermediate is a point between 2 points. It's a point between medial and lateral, right? So if we were addressing the body of the clavicle right here, we would say that this was intermediate. Why? Because it's between the medial end and the lateral end. Okay, so intermediate is just a point between 2 points as far as medial and lateral is concerned. Proximal and distal. Now, proximal and distal are two terms that are relative to a point of origin, right? Where does something begin? Where does it start? And typically, when we're using proximal and distal, we're using them to describe structures within the extremities. All right, we don't like to use superior and inferior when we describe structures in the extremities. I mean, could we technically? Yeah, we could, right? I mean, I could say that this elbow is inferior to the shoulder, or I could say that the wrist is inferior to the elbow. But in reality, it's only inferior like that if the arm is in this position. If I take the arm and do this, now the wrist is inferior to the or superior to the elbow. But proximal and distal use a point of origin as its reference. So where does the upper extremity begin? It starts right here at the shoulder. So the closer we get to the point of origin, we're proximal. The further we get from the point of origin, we're distal. So now if I compare the elbow to the wrist elbow is proximal to the wrist. The wrist is distal to the elbow. Can the wrist also be proximal? Sure, it can. If we take the wrist and compare it to the fingers, the wrist would be proximal to the fingers. The fingers would be distal to the wrist. And that doesn't change, right? Elbow, proximal, wrist, distal. Doesn't matter what I put this arm in, it's going to still remain proximal and distal. So we use this when we talk about the extremities, the upper and the lower. Ipsilateral, contralateral. Ipsa is a prefix that means same as. Contra, it means opposite as. So when we talk about ipsilateral structures, we're talking about structures on the same side of the body. How are we dividing the body? We're using that midline. Contralateral means structures on the opposite sides of the body. So ipsilateral would be like right hand, right foot. Contralateral would be like right hand, left hand. Superficial and deep. Superficial means closer to the surface, right? So when we're referencing the surface of the body or the surface of an organ, okay, that would be the most superficial part of that organ. The furthest away from the surface would be deep. So when we're talking about two structures, we can use superficial and deep. The skin is superficial to the muscles. The muscles are deep to the skin. Now, I said before I wasn't going to make you learn all of the terms here. Instead, what I want you to do is on the next two slides, I give you about 16 of the body's terms or regional names or markings. And these are the ones that I'm going to test you on as far as the exam goes. Now, I could test you on these just, pretty straightforward and say, what is cervical? What is the wrist? And you'd have to tell me it was carpal. Or, and I like doing this, or I could test you using these terms and directional terms. Okay, so I could say, straightforward, what is the patellar region reference? Or I could say the patella is what to the inguinal region. Now you have to know what patellar is, you have to know what inguinal is, and then you have to be able to know how they're related to each other. No, lab, you have to know all of them. In here, I'm cutting you some slack, but in lab, you got to know every single one of them. So the ones you need to know in here, cranial. Cranial refers to the skull. Cervical. Cervical refers to the neck. Cubital. Cubital refers in general to the elbow, all right? The posterior of the elbow. The front of the elbow would be antecubital. Carpal is going to mean the wrist. Patellar, the knee, okay, the kneecap actually. Popliteal would be the posterior of the knee. Orbital is going to be the eye. Thoracic, the chest. Inguinal, the groin. Metacarpal, well, if carpal means wrist, then the metacarpal are going to be the bones of the hand. Plantar is the sole of the foot, okay? Dorsum would be the top of the foot. Buccal is cheek. Axillary, armpit. Femoral, thigh. Gluteal, buttock. Tarsal is ankle. We have carpals in the wrist. We have tarsals in the ankle. And then digit or phalangeal, this is going to mean toes or fingers. Okay. Now, it's not digits means toes and phalangeal means fingers. Digits can be toes or fingers, and phalangeal can be toes or fingers. All right. So these are the ones that you have to be able to identify in here. Again, I won't give you a picture. I'm not going to give you this diagram and ask you to point to it. I'll do it more in a definition capacity, or like I said, I'll use the regional names in conjunction with the directional terms, and you'll have to know the regional names to be able to apply it to the directional terms.
Can you go back to the first page?
You know,
Yes, thank you.
Don't try to copy. You got this PowerPoint, so I don't want you to have to I don't want you furiously trying to copy all these down. This PowerPoint's on Canvas. You can copy them down if you want, but you can print this out and then you'll have them. So
I have a question.
yeah.
On the picture right there, could you show me the sacral real quick? Because that one's kind of like confusing me with the inguinal, because the sacral says between the hips and then the inguinal is the groin area.
The sacral is going to be posterior. All right. So we
Okay.
can't see it on either one of these because it doesn't, it's not showing. But when you look posteriorly, the sacral region is going to be the region just below the lumbar region. Lumbar is lower back. So the sacral region will be just below the lower back between the hips.
Okay, thank you.
And when you look on here too, and this is just for lab as well, pelvic or pubic is going to be right in the center, and inguinal is going to be in the groin region on either side. So, you know, when you get into that area, you know, it's like, okay, well, is it this or is it this? You know, it just depends on where it directly is pointing to. All right. Next thing is about body planes. Body planes are ways of us being able to look at structures of the body. All right. Why is it important for us to understand how we're looking at different structures of the body? Well, because depending on how we're looking at them, it can then tell us what exactly that we're looking at. I'm going to go ahead a couple of slides and then come back because I want to show you exactly what I mean. When we talk about identifying a structure based on how it looks, this is actually the best picture that we can do that on. What we have here is a section of the brain, okay, cut 3 different ways. I'm going to point to a structure on each one of these that is the same on all of them. All right. The structure I'm going to point to, which we'll do when we get to the nervous system, is the corpus callosum. And on this view, the corpus callosum is right here. All right. Right where I draw that arrow right there. Okay. That's the corpus callosum. On this view, the corpus callosum is right here. And on this view, the corpus callosum is right here. And it's right here. It's the same structure, folks, on all 3 views, but you can see how significantly different it looks on each one of these views. So this is the importance behind body planes, is understanding how am I looking at this structure, or how am I looking at this organ, or how am I looking at this body, all right? Because if you can understand how you're looking at it, you then can understand, well, what structures am I going to see within this view? Now, when we divide the body into right and left sides, we use what we call a sagittal plane. Now, there are 2 different types of sagittal planes. One is a mid-sagittal plane, and a mid-sagittal plane is going to go right down the midline of the body. So again, that fictional line that we drew right down the center of the body, which separates the body into left and right mirror images, is going to be the mid-sagittal plane. Okay, there's only one mid-sagittal plane. Any plane, though, that divides the body into right and left sections that are unequal is considered a parasagittal plane. And there are infinite numbers of parasagittal planes, because remember, each plane can get progressively smaller. So we can make as many parasagittal planes as you possibly could, okay? There's no limit to the number because we can move it over just a fraction and it's a new plane. So if we divide the body into left and right unequal portions, it's a parasagittal plane. But if we divide the body down the midline, it's a mid-sagittal plane. A frontal plane or a coronal plane is going to divide the body or an organ or a structure into a front portion and a back portion, or an anterior and posterior portion. All right, so if I turn sideways like this and you cut me just like this, you're cutting me into a front portion and a back portion. That is a frontal or a coronal plane. Now, we can have an infinite number of frontal and coronal planes, but we cannot have a mid-coronal or mid-frontal plane. Why can we not have a mid-frontal or a mid-coronal plane?
Because it's only, you have to have both sides equal. It has to be right in the middle only one. Right,
both sides have to be equal. I mean, the easiest way to think, the front doesn't look like the back, right? So it's not a mirror image. So we can't have a mid-frontal or mid-coronal plane, basically just because the front doesn't look like the back. We can never make them equal. Now, a transverse plane or a horizontal plane or cross-sectional plane, that's going to separate the body into top and bottom. And again, we can have an infinite number of these transverse planes, but we'll never have a mid-transverse plane. Even if you measure and go directly at the halfway point of the body, it's still not a mid-transverse plane, again, because the top and the bottom are not equal. The top doesn't look like the bottom, okay? It's not a mirror image. So again, the only mid-type plane we're gonna have is a mid-sagittal. You'll never see mid-transverse and you'll never see mid-frontal. Now, all of these planes we've discussed so far either run perpendicular to the floor or parallel to the floor, meaning they're either at 90 degrees to the floor or they're at 0 degrees to the floor. Anything that is not at 90 or 0 is classified as an oblique plane, okay? And that oblique plane can run at 30 degrees, it can run at 10 degrees, it can run at 1 degree. Any plane that's not one of those others, sagittal, coronal, or transverse, is going to be classified as an oblique plane. Now, for those of you that may be going into radiology, you're going to see planes again. You're going to see body planes. You're going to use these terms when you talk about imaging and things like that. All right, we're going to use these terms when we talk about viewing different structures in the body. All right, particularly when we get to things like the nervous system. But we'll start to use terminology like this even when we get into tissues, which we'll start next week. All right, we're going to stop right there and we will start body cavities on Monday. And that'll take us through and we'll finish up chapter 1 Monday morning. Any questions about today's stuff?
I don't have anything about the stuff that we went over with. Do we have any assignments that are due that we have to do today?
For in here, well, you got chapter 1, it's due on Monday.
Oh, okay.
Yeah, chapter 1 assignment is due Monday, and then we'll finish up chapter 1 Monday as well. So make sure you get that done. And like I said at the beginning of class, make sure you get your respondents verification assignment done as well, so I can make sure that I know who has access and who doesn't to respondents, and we'll work any kinks out with that. So all right. Well, if y'all don't have any questions, I will let you go. I will see. Yes, question.
One more question about responders.
Sure.
Like original video, you're supposed to have everything clean for exam, but when we make the test video, do we have to clean everything around?
Wait, say that again.
Like, when you do test, you're supposed to have clean area, or like your table, no papers, no anything. But if we're doing just this test, do we have to clean everything?
No, you don't have to have everything for the responders thing. I just want you to do the environment check the way that you should do it. Okay,
Yeah,
so just make sure that you're showing me everything around you, but you don't have to have it clean for this. Just I just want to make sure everybody's doing it properly. So
Yeah, that's what I want.
Okay.
Thank you.
Sure. All right. Well, I will see some of y'all tomorrow in lab. Everybody else, y'all have a great week and have a good weekend. And we'll finish up chapter 1 on Monday.
All right, have a good one.
All right. We'll see you later.